Hey, how's it going, everyone? Welcome to PT Topic. My name is Patrick Liu, student physical therapist at the University of Maryland Eastern Shore, and today's topic is going to be on Virginia's House Bill number 45, talking about the reimbursement services for licensed athletic trainers. Now, before we get started, please make sure to press that like button, subscribe if you haven't already, click the notification bell, share this video with your friends, family, dogs, cats, share it with everyone. And leave a comment down below about your thoughts about this video. I will say this might be a little bit controversial. However, I'm just going to state my opinion based off of my perspective, as well as my values as trying to progress the interprofessional healthcare profession forward. As we get started with this bill, it essentially is wanting to include the term athletic trainer for reimbursement services for certain practitioners aside from physicians. What this essentially means is people will be able to see athletic trainers as a healthcare provider and seek out their services. They will be joining other healthcare professions, notably physical therapists, chiropractors, speech pathologists, nurse practitioners, social workers, and many more occupations. For the Virginia's APTA statement, they essentially stated that athletic trainers are not prepared to practice in the same independent environment compared to other healthcare providers currently mandated for health insurance payments. And they think that the educational limitations could easily place themselves outside of their skill set and scope. Furthermore, they expressed these different points, saying that there is no demonstrated need for the expansion of payments since they are being paid directly by universities, colleges, school systems, professional teams, or other athletic associations through direct employment and contracts. That the Centers for Medicare and Medicaid Services, working closely with the American Medical Associations for treatment coverage and recommendations, don't recognize athletic trainers as capable of providing therapy services to their beneficiaries. And this is due to their bachelor's level degree of education. Despite advancing to the master's degree, CMS doesn't feel that they have sufficient education or the skill set or mindset to be a provider for rehab services. And essentially, many athletic trainers in Virginia still hold a bachelor's degree, and their level of education doesn't prepare them to deal with medically complex individuals across the lifespan compared to other rehab professionals such as physical therapists or occupational therapists. And since the bachelor's trained athletic trainers are still practicing, Virginia limits their ability to provide safe and effective care to medically complex patients, essentially saying the same thing because most athletic trainers have a bachelor's degree. They cannot care for those medically complex patients. Additionally, they're also saying that for those physical therapists who were educated at the master's and bachelor's degree level, return to school to obtain their doctor of physical therapy, and those who don't possess a doctor of physical therapy, they must obtain advanced certifications to practice in advanced treatment environments. The fourth point that the APTA of Virginia mentioned is the bill has an unintended result of expanding the athletic trainer certifies access to non-athletic and potentially more medically complex populations who fall outside of the AT scope of practice. And the expansion of their practice could pose potential safety issues, and someone who exercises this cannot be equated to being an athlete, and the same is true for someone who has an occupation that requires significant physical activity. Their injury and health status may be substantially different than those who fall within the current AT scope of practice. To essentially recap, it seems like the physical therapist of Virginia, based off of this talking point. Now, I'm not saying this is every physical therapist in Virginia, just saying from the statement that the Virginia APTA has taken is that they don't want athletic trainers to join the healthcare professional team because they are afraid that they might take the forms of payment and reimbursements from insurances from physical therapy services, as well as them not being competent enough to deal with patients with more medically complex cases. Now, from my perspective, I would like to rebuttal these different talking points by citing this journal article from 1994. The title is called "The United States Army Physical Therapy Experience: Evaluation and Treatment of Patients with Neuromuscular Disorders" by Dr. David Greathouse and physical therapist Richard C. Schreck and Cindy J. Benson. Hopefully, I pronounced your names right. And what this article talked about, and I'll just kind of preface this, is that Army physical therapists, this was before physical therapists were a doctor of physical therapy degree, because this was back in 1994, and physical therapy became a doctoring program in 2005. Essentially, during World War I, Army physical therapists had unique experiences to orthopedic physical therapy, and their education process and such allowed them to work with the military personnel as well as surgeons and orthopedic physicians in the front lines. To kind of preface and summarize what this article talked about, essentially they divided up the roles where instead of seeing a physician first, whenever someone was wounded in the war, they would see the physical therapist first to see what was going on, or after they've completed a rehab protocol, they'd be evaluated by the physical therapists. And then if the physical therapist deemed that the case was too complex for them to work with, they would refer them out to talk to the physicians instead. Now, what they found based off of this method is that it's actually helped supported so many of the military personnel since its implementation in the 1970s. The use of physical therapists as primary neuromuscular skeletal evaluators has been a resounding success with high acceptance by patients and practitioners, especially orthopedic surgeons. To also premise this as well, before physical therapists were introduced as frontline healthcare workers, physicians and surgeons and other healthcare occupational workers that are currently existing now, they didn't think that physical therapists could have been able to care for patients with these different diagnoses or medical ailments and such. Now, this is kind of the same argument that's being talked about right now. And based off of my perspective, I feel like physical therapists limiting down and being saying that athletic trainers are not able to treat and care for patients based off of people not being athletes and due to their level of education with a bachelor's degree is completely outrageous and absurd, and that as controversial as that may seem, because athletic trainers, like athletes, is such a vague term that they're not really working with athletes per se all the time. Based off of my experience in Utah, there were some athletic trainers who worked as independent contractors, and they worked with occupations that required a lot of physical labor, such as construction workers and construction companies. And those employees of those programs, when they hired the athletic trainers as independent contractors, they found higher success rates in them learning and understanding safety techniques on the field, proper lifting mechanics, and a variety of different other safety and prevention mechanisms, as well as rehab protocols too, in case if they, let's say they sprain their ankle while on the job, or something drops on them and they receive a neuromusculoskeletal injury that needs and requires care. And that athletic trainer could be the person in the front lines to help provide treatments. And if it's outside of their scope of practice, they could always refer out. This article, and I'll leave the article's description and such inside the comments down below, as well as these other documents here, that I think that athletic trainers play a huge role in providing that direct access for patients. And it should be necessary to progress the profession forward, not only for athletic trainers, but I also think physical therapists, it would also progress our professions forward by allowing athletic trainers to be a part of this and recognizing them as healthcare workers because of how much of the care that they can provide and succeed with, as well as understanding that, hey, maybe this person doesn't quite need to see the physical therapist because of like time constraints. Instead, they could see an athletic trainer first. And if the athletic trainer deems this is outside my scope of practice, they then can refer that out to physical therapists. Not to mention, I know for Utah and Maryland, there are plenty of professions or plenty of professionals who are currently caring for patients with their master's degree or their bachelor's degree, and they are doing continuing education units, which is a requirement for all physical therapists that I know of, with the exception of two states, the state of Massachusetts and the state of Vermont. Of course, I could be wrong in this, and they might be updating some of these changes, but this is up to the knowledge that I know of, that other states will require continuing education units. I know the same could be said for athletic trainers, where they're all required to take those continuing education units to stay on top of their materials and programs. So I think the argument saying that because most of them are bachelor's degree or like a master's degree and it's not enough, I think that is not a great talking point or point to try and object this proposal, because there's also other practitioners who are using a master's degree and caring for patients, and if it's outside the scope of practice, they would just talk to another specialist. Prime examples would be the nurse practitioner, Google search, they require a master's degree. Acupuncturists in the US, aside from an accredited acupuncture or Chinese medicine program, like with a master's degree, they have that. Clinical social worker, a master's degree as well. That it is essentially a poor argument to say that they won't be able to treat those who are more medically complex with those cases. And when in actuality, it's like, no, they will be able to treat them. It's just a matter if it falls outside their scope of practice, then they could delegate that work to physical therapists and such, so that physical therapists don't feel as overwhelmed for their patient load and everything, especially with clinics that maybe allows a physical therapist to see like 10 to 20 patients a day. Instead, it's like, no, we can handle some of that caseload by allowing an athletic trainer to see them. And if they require further or more complicated and complex treatments, to refer out to physical therapists or their physicians and such. And then with this statement over here that says for the CMS and the American Medical Association not recognizing ATs as providers as capable for therapy services, well, I feel like that's kind of an outdated thought and mindset, because prior to that, and according to this article over here, there are plenty of physicians and even the medical associations that thought physical therapists weren't competent enough to be healthcare providers, especially patients with neuromusculoskeletal disorders. But they proved that otherwise, and physical therapy has grown to be such a great force of who they are today. So I'd say give athletic trainers a chance to practice and actually help patients out and give them that direct access probability. Because after all, the care for health insurance, the care for healthcare is just so astronomical that maybe it might be better to allow us to work with these different professions, and the patients will have easier access and they could see those people directly. And then if the athletic trainer finds out, oh, well, I feel like you'd be better off seeing a physical therapist, and then it could actually allow for better access and maybe even better reimbursements. That's just my opinion. And then them demonstrating no need for expansions of payments, I feel like this argument is kind of rough, and I feel like the APTA should direct more of their focus on increasing the insurance reimbursements for their profession itself, instead of saying there's no need to pay the other professions trying to get into the pool to try and help them out. Because one of my mentors back at Weber State University, they mentioned how if 10 people were in the room and they all received like an ACL injury, but 2 people can see there was only like 2 physicians that could directly see 2 of those people, they would have a healthcare provider. And then we have a physician associate that's able to see like 3 people, great, they're able to get covered. A physical therapist who's able to see 1 person, great. A nurse practitioner who's able to see 2 people, which is great. That still leaves 2 other people out with an ACL tear that can't see anyone because of these other healthcare providers having their schedules busy and loaded with that. So by allowing athletic trainers to come into the playing field here too, they could actually be ones to help with the pre-rehab for those with an ACL tear for those last two, as the other patients are receiving the care that they need and just allowing people to get the healthcare resources that they need. So instead of treating patients as just a number, we could actually work with each other and help treat the patients. All right. Thanks again for tuning in, everyone. I hope you enjoyed this video. And again, please like this video if you haven't already. Subscribe if you haven't already. Click that notification bell and leave your comments down below. And I know this, again, I know this is a pretty controversial topic, but I would love to hear your perspectives and opinions to kind of debate this about this a bit more. And thanks again for tuning in. Have a great day, y'all.